So, can I do burpees during pregnancy? I get asked these kinds of questions all the time. Can I do fill the blank during pregnancy? And um, my the beginning of my answer to that question, or my first question to that question, is when. When you're 1 month pregnant, that looks very different to when you're 9 months pregnant. And so I just want to kind of take a few of um, these topics or these movements like planks or running or whatever, and talk about how that might look different throughout the pregnancy, and when you might be able to do it, when you might not be able to do it, and just apply a little bit of logic to the answer, rather than coming up with this like black and white sort of answer. So burpees. And the big thing that's going to get in the way with burpees is the belly. If you were doing burpees before pregnancy, I mean, burpees get a bad rap. Some people sort of think, it's bad for your back or like whatever. But burpees can actually be a really great way of getting your heart rate up if you do them properly, like everything else. They can be a great movement, and very low impact, really. So if you were doing them before pregnancy, let's think about what that looks like when you get pregnant. You don't have a belly yet. Lying down on the floor and then getting back up isn't really going to be very problematic. There's no high impact sort of for your joints or for your pelvic floor, not if you do them properly. You should be able to breathe through the movement, so breathing out as you push up, and just keep your breath going rather than holding your breath. You don't necessarily need to do a burpee with a push-up, although lots of people do it that way, but you can kind of peel down onto the floor and peel back up. But from not being pregnant to just after conception, nothing's really changed. There's no real reason why you can't do a burpee, why you can't lie flat on your belly. And it can be a really nice way of getting your heart rate up. If you're pregnant in a hot country during the summer, you don't have to go outside. You can do it inside. There isn't really any reason why you shouldn't do it. But as soon as you start to show, as soon as you have a belly, you're not going to be able to lie down on the flat on the floor. There's going to be a cut-off point where that's not possible anymore. It's not healthy, it's not good for anyone, and it's going to feel really uncomfortable. And obviously from that point, we're not going to lie flat on our belly on the floor anymore. But it can take a few months to get to that point. And my question is, why not do burpees if you can, and if you don't have a tummy yet? A lot of people won't agree with that answer, but I think it's a shame to stop someone from doing something that she can do unnecessarily. So you might sort of say, well, I could just do a burpee, but with like a plank. I could do that till my 9th month. Just instead of lying flat on the floor, just put my hands down on the floor and step back into a plank and then step back up. I'm going to make a whole separate video on planks, but the chances are is that at some point, you might be able to do that for a little while, but at some point, your tummy is going to be too big, and you're probably going to bulge. And even if you don't bulge, what is the purpose of doing a plank during pregnancy? There are some cool alternatives to a burpee that I'm going to make a video on, that you can do right the way through to the end of your pregnancy, that's more fluid, that's more dynamic, that prevents pressure on or a lot of weight. If you're in a plank position, there's a lot of weight on that front, the anterior abdominal wall, and it's probably not going to be so beneficial for you. But that's an entirely different discussion. So there are some other alternatives so that you don't have that pressure on the anterior abdominal wall, but that will equally sort of get your heart rate up and use your whole body. So there basically there is going to be a off point, and planks are not something that I really think that pregnant women need to be doing. So there's no point really adjusting the burpee to doing a plank, although it can all be graded. So you start off doing burpees, and then as you get a bit of a tummy, you can just walk out to a plank instead of lying flat down on the floor. And then when the cutoff point, when you can't do that anymore because you feel like your tummy's bulging forward and your tummy's too big to do that, you can just stop doing burpees or do something that's similar to a burpee but that isn't a burpee and that doesn't have that pressure on the anterior abdominal wall. So there's this sliding scale. Pregnancy is dynamic. Pregnancy changes. The goalposts change throughout pregnancy, and so should your fitness routine in order to fit that. It's just about knowing what to look out for and what things could potentially cause damage that we want to avoid, and which things are safe at different stages throughout your pregnancy. But there's no sort of like black and white answer, and it's definitely not a case of you're pregnant now, stop doing everything. We need to grade that change to suit the level of pregnancy and the stage of pregnancy. Having said that, I don't necessarily think that if you weren't doing burpees before pregnancy as part of your exercise program, it's probably not the sort of thing that you need to start doing now. There are other less taxing exercises that are probably more suited to pregnancy than burpees, and it's certainly not something that I would get a newly pregnant woman to do if she wasn't doing them before. So keep that in mind. Were you doing them before or were you not? How far along during your pregnancy are? Is the belly in the way? Does the belly bulge? Lots of questions and lots of things to think about. Can you breathe out throughout the movement? Is it smooth? Is it low impact? Lots of questions and lots of different factors to think about in making a decision of if to stop, when to stop, and how to do it safely. So I hope that was helpful. I'm going to make some other videos about similar movements and discuss how appropriate it is for a pregnancy program.